Planet Vero Studio is powered by the Nolan Group of RE/MAX Associated Realty. MyNextHomeFinder.com.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soule.
And good afternoon, and welcome to Community Conversations. You know, Treasure Coast Community Health provides a lot of services: medical, dental, behavioral health, pharmacies at a discounted price. We've even added vision services to our repertoire of primary care services that individuals around our community can really use and trust. But along the way, we started realizing that our real mission is to build healthier communities. Whether you live in Fellsmere or Gifford or South Vero, we really are looking at how can we make the whole community healthier with focus on individual items. And that's why, even though as a CEO, there's plenty of work sitting on my desk at any given time, I'm very reluctant to give up this time with community members, having conversations that help you understand better what goes on in each of our lives and around our community. So today I've asked a very profound and friend physician here, Dr. Borromeo. Dr. Borromeo is a psychiatrist. She is board certified in children's psychiatry, as well as, I know, has done a little bit of time with some adults. So she's very broad-based. And we're very, very fortunate to have her because of the work that she has done with teenagers prior to her coming to us, which I think is now 10 years?
14 years.
Yeah, but who's counting, right? So, as well as working with all of our children now from about 4 or 5 years old and up.
4 or 5 years old and up.
Okay.
And I have also made it a habit to see some of my, I don't want to advertise it. I probably don't want to talk about it here. Oops. But sometimes I do follow young adults.
Mm-hmm. You get them through that transition. Particularly the boys, I think, have a harder time reaching their adulthood, not chronologically, but emotionally.
I like to follow kids when they enter college and see them through that transition in college.
And that's widely appreciated, I know, by both parents and students. So thank you for that. So today, we missed an opportunity in February, but I didn't want to miss it permanently. You know, every month we are recognizing different health awareness weeks. And February, like October, is really jam-packed with different organizations and different awareness weeks. One of those weeks really struck a chord in me, though, and I asked Dr. Borromeo to come and talk to us a little bit about it. And that is about teenage violence in dating and relationships, because we know that we should be talking to our children before they start dating. But most parents don't, because they've still got this mental image of their child in grade school. And then, boom, suddenly they've got eyes and interest in others. So I know that you have dealt with a number of individuals who have had some problems like that, where something innocent turned into something violent, and then there was ramifications or repercussions from that. So let's talk a little bit about the preventive piece of it and what parents might be able to do before disaster sort of strikes. Mm-hmm. What kind of relationships or things should they be working towards?
Parents are always the first and the most important role models to any child, whether it be a very young child to even a teenager, as they're getting ready for adulthood. And the best thing that a parent can do is, as adults, be their role model in showing how you ought to respect, love, and care for your partner, wife, mom, dad. They always look up to their adults in their lives, and that's the best thing that any adult can do for their children.
So bite your tongue when you're wanting to retort to your husband about...
Mm-hmm. I'm not saying. I'm not either saying. I'm not saying that we should never fight with our husband. I think it's important to show that fighting or arguing is a normal process, but fight fair.
And it doesn't have to be physical.
That's right. No physical. And most of all, the most obvious is, of course, you must not use violence in the home. You must respect the other as a person. You must not put your partner down. You can fight. Many therapists will say, use the I word. Communicate by saying, I feel thus and thus. But there's a good point to this. When you fight, you want to fight fair. You don't want to put down your partner. You don't want to insult them. You don't want to belittle them. Be sarcastic in a way that really diminishes them or belittles them. That is part of a cycle of abuse. And as you will tell later when we talk about the telltale signs of abuse in teen dating, those are the very behaviors that people who tend to be violent use. So fight fair when you're fighting with your spouse. It's not, neither is it a good idea to be completely conflict-free in the home. That's fake. It is. I do not believe that children should be completely in an environment that's sanitized where parents do not fight. That's not realistic. Right. That's not human even.
I have to say, I have had my children observe me go back to my husband and say, I was wrong when you said this. And they're like, what?
Yes. And so we need to show our children what is good conflict resolution and what's fighting fair.
Absolutely.
What's fighting in a nonviolent manner. So we are, as parents, the best guides, the best role models for our children. So prevention always starts at home.
And I would think, even though parents are working and come home tired, there's probably some opportunities during the week, nonetheless, where children are relaying something that they saw or heard at school relative to conflicts. And so do parents have an influence in that, even though they weren't there at the time?
Of course, they have. What child nowadays is immune from being subject to stories on the news and even their very schools having instances where people or students make threats. And the sad thing is that it has been so common, mass shootings, all of that. You see it every day on the news, and we have become almost immune to them, not even paying much attention
as
to them. As adults.
But as children,
it makes an impact. But when somebody at their school makes a threat, it has to be very frightening, especially to the very young children. I see a lot of teenagers, even high school students, where their anxiety is aggravated, and they start not attending school because of their anxiety, because there are threats made, etc. So it's very unfortunate that violence is in our world now. So it's not something that you can prevent younger children from hearing or seeing even.
But I can remember my grandmother telling me, you can come here anytime. It's always safe and fun at Grandma's house. Now, there was nothing unsafe at my home, but in her little mantra, where she only lived a couple blocks away, and for whatever reason, she was lonely, wanted me to come over more. It's always safe and fun at Grandma's house.
Sure.
And I think that safety factor is really what you're getting at.
Sure. I was also hearing in a news in NPR some feature talking about how we help our children with violence, young children they were talking about. And there are many of us who turn on the news all day.
Just for the noise.
Just for the noise. But then we forget that very young children might hear that news, and in their little minds, they don't have a good sense of what's real, what's right next to them, and
The
what's not.
context of the conversation.
So we can minimize that.
Oh,
And
good
when
point.
you allow your child, your very young child, to listen to the news, of course, it's best that you sit with them or that you're there available for their questions.
I would even say beyond little children. I have a 12-year-old, and we watch the news together because sometimes the context, they use vocabulary words he's not familiar with, and that puts a whole different slant on his understanding.
Sure. So it is something that every child is exposed to, but we as parents have the role of putting things in context, helping the child remember that it might be something of a distance, or acknowledge that yes, indeed, it is a problem, but and doing what we can to make that child feel safe.
Mm-hmm. Just like I was a product of the Cold War 50s and 60s, where we would, instead of fire drills or just fire drills, they'd bring us all into the center of the school. Because we were concerned about the Cold War. Well, we didn't know what the Cold War was, but we felt pretty safe and secure all together in the middle of the school, clutching our knees. And then the teachers, after a couple minutes, would say, okay, you did great. Let's go back in. Now we're prepared.
But the Cold War was far away.
It was.
Right? And now children will have active shooter drills.
Yeah.
That is scary.
That is scary. That's scary for adults as well.
That is scary. That has to be very scary, and a sad commentary on where we're at in terms of violence.
So by teaching our children better about coping mechanisms and how to resolve conflict and how to get along better and to learn to have empathy with people, that's part of that building healthier communities, because the impact of we're living now, and we need to turn that corner. You're right.
Absolutely.
That's part of healthier communities. So we're going to take a short break, and we'll be back after a couple of words from our sponsors, and then we'll talk a little bit more in depth about teenage violence in dating and other exposures. The new year is underway, and it's time to schedule your annual physical. This quick, comprehensive visit can uncover diabetes, high blood pressure, and even cancer, ultimately saving your life. Treasure Coast Community Health waives Medicare deductibles and offers a sliding fee scale discount, so everyone can afford to take care of their health. We can't fix what we don't know. Let's work together to make a healthier community. Call us today at 772-257-TCCH. We're a nonprofit.
Revive Vero Beach, located next to Anytime Fitness on Oslo Road and 27th Avenue, has everything you need to look and feel your best, including hormone replacement therapy, stem cell therapy, sexual wellness, weight loss, laser aesthetics, hair, tattoo, and skin spot removal, Botox and fillers, cryotherapy, comprehensive blood work, and everybody's favorite, ozone and IV therapy. Refresh, renew, and revitalize yourself at Revive today. Call 772-492-6607. A member of the iTex trading community. Your iTex dollars are welcome.
Hello, this is Carol Jean Jordan, your tax collector here in Indian River County. All of our offices are scheduling appointments for in-office services, but you can get that little yellow sticker quicker by using our Express Lane. It's fast, convenient, and free when you pay with an e-check. Renew your registration on our website and select Pick Up at the Tax Collector's Office. Order before 3 p.m. and you can pick up your little yellow sticker on the same day. Order at irctax.com. That's irctax.com.
Water service? Don't let your money go down the drain. Make sure to get a quote from Affordable Water. Many times, Affordable Water's original price is less than the competitor's discount price. Yes, Affordable Water really is affordable. Make sure to get a quote today, because you haven't gotten a quote until it's affordable. Affordable Water.
Call 589-7677 for your H2O. Call the Pure Water Pros. Affordable Water.
And welcome back to Community Conversations. I'm Vicki Soule, and if you're just joining us, I'd like to help you catch up just a little bit. We have a very unusual guest in that we've been talking about some violence things. Dr. Borromeo is one of our psychiatrists. She's board certified in children's psychiatry. So she helps children work through issues. She also does medication management for them, counsels the parents, really does an excellent job of helping us in both short-term and longer-term situations with our children. And the topic today, technically, is teenage violence, although we spent some time at the beginning talking about how violence permeates our culture these days and how important it is within the family to act as a cushion, as a support, so that the world isn't such a scary place. And I'm paraphrasing badly, I know. but February was Teenage Violence Awareness Month, particularly as teens are typically dating and don't really have a lot of experience or a lot of mentoring other than what they might have gotten through family relationships or friends. We missed the February awareness date, so we're just not going to give it up because it is a very important topic. And so I've asked Dr. Borromeo, because she sees a lot of young women especially, and some young men, who have been traumatized by something that started out very innocently and then perhaps turned into something not so pleasant. Mm-hmm. So tell us, why is this a common phenomena? I mean, are a lot of people affected?
Well, really, being that I received the tail end of these issues, meaning to say the child or adolescent that has been a victim of violence, either in the home or elsewhere. I was amazed when Vicki gave me some data to review at how widespread apparently teen dating violence is.
Well, we don't want to talk about it.
Yes, apparently 1 in 14 girls teenage girls have reported some experience with dating violence, and 1 in 10 boys, or sorry, it's the reverse.
Other way around. 1 in 10
1
girls.
in 10 girls and 1 in 14 boys. So it's quite frequent from the sounds of it, from these surveys. We don't really think about it. And just reviewing for this has made me even more aware that I must ask certain questions. For example, there is so much comorbidity. In other words, when 1 or 2 disorders are diagnosable. For example, with PTSD, which is the end result of being the recipient of violent behavior or traumatic experiences, it is comorbid, or it goes along with major depressive disorders and anxiety disorders in 30 to 50% of these cases.
Wow.
So a really big comorbidity factor. So as I said, I always am at the tail end of things. Either the child is depressed, or there might be PTSD, or I see anxious. Anxiety is a big deal nowadays, especially with COVID. But it makes me more aware, knowing more and more, having talked or studied the incidence of teen violence in dating, to actually ask more incisive questions.
Well, I think that's the whole idea of bringing this forward, is people don't talk about it. And in doing some research myself after February, the violence can be a physical violence where they are physically afraid of their partner. It can be a sexual violence where they're being coerced or forced into an act that they don't want to participate in. Doesn't necessarily mean intercourse, but any activity that has a sexual overtone to it. And I guess in my mind, I hadn't discerned those differences. And certainly we all think about violence as physical and sexual abuse as the other, but sometimes they do overlap. Because
they do overlap, period.
Okay. Thank you for clarifying.
They do overlap. Really, we sometimes aren't very keen at asking For example, I see a lot of depressed teenagers, girls, for example, more commonly than boys, but girls and boys can be depressed, of course. But when I see a depressed female teenager, for example, I've become more aware to ask specifically for their relationships, their dating relationships. And when you hear about things like, oh, my boyfriend is very possessive, they're very controlling, I cannot do things without his permission. He calls me all the time. I don't have privacy. And when you hear more about the attitude, because people who are who tend to be violent might have a very belittling attitude, might use derogatory language.
You're stupid. Nobody else would want you.
Yes, yes. And you hear those, and of certain injuries that have no explanation, of a young woman, teenager, not all of a sudden not being social, not going out with friends, not doing the things that they're used to doing or enjoy doing, and their activities have become more restricted.
So
and
those are signs for parents to see.
That's right.
Okay, but having had teenagers myself, although I'd love to rush in and fix things for my children, I found that sometimes that blows up in my face. What do you suggest when parents see those things? They can't all send their children to you. You only have so many hours in a day.
You want to be able to elicit some more information. You want to ask questions that might give you more hints as to, is my child, is my daughter in an abusive or a violent relationship? It may not be altogether violent, but it might be leading to that. What are the danger signs?
So having those conversations then with your children, asking those leading questions, not giving your opinion, but as you say, eliciting more information, thinking questions.
Correct.
Okay.
Right.
Okay.
Right. And also other signs, like for a bright child, an A student, all of a sudden with declining grades, and as I said, one who used to be social and used to love being with family, just being more restricted and more isolative. Well,
I've heard the same thing about when children start taking drugs. Could the two be related? Is it one or the other?
Well, earlier on, we talked about disorders that exist together. Drug and alcohol abuse are quite common in people who have been subject to violence because they are anxious, they are depressed, and
the coping
they might
mechanism.
be self-medicating with drugs or alcohol. So it's not uncommon to see that happening, and it happens with children who are anxious, who are depressed. You see that very frequently.
That's a scary, scary situation for most parents.
Oh, yes. But scary as it is, I think it's important to be able to invite your child to communicate with you, because most of all, they are distressed and they really are ashamed. They're afraid to talk. And
afraid of the consequences.
But also quite embarrassed. How can I, a bright person, a child, subject myself to such?
You just demonstrated real empathy, and that's what we're trying to build in children as well. So I absolutely appreciate everything that you've said. I wish we had a lot more time, but unfortunately we don't. It passes really quickly. But I'd love to have you come back and talk to us more about our children and how we might be able to better help them. Thank you, Dr. Borromeo.
You're welcome.
And thank you for being with us this week. I hope that this has added to your repertoire of coping skills as we build healthier communities. Have a great evening.